Hey, it's Dr. DeCubelos here. I wanted to do a quick take on something that I think is really being underrated and not looked at as significant of an injury as it really is. And that's when we talk about ligament instability. Now, here's the thing is we have to understand why this is so severe. And when it comes to ligaments, there's three different grades of ligament sprain. Grades 1 are going to be transient, they're going to heal on their own. Grade 2 is actual partial tearing, and 3 is complete tearing of the ligament. Most of the time, we're going to be talking about grade 2. Grade 3s are going to be ones that are going to most likely require surgery, not all the time, and they're going to be able to be easily found, but the ones that are the grade 2 are ones that are unfortunately looped in with grade 1 and not looked at, and then they become permanent issues. Now, what happens with these ligaments is that inside a ligament is made up of collagen and elastin. Now, the problem is that after puberty, our body no longer creates any more elastin. So when we injure these ligaments or tear these fibers, we are now putting immature collagen in to replace the elastin that's there. This means that that ligament is no longer going to be as flexible as it was prior to the injury, and that's permanent. Now, that's all well and good, but the reason that this is so interesting is that research is starting to show that because this happens, when we have these ligament injuries, they're finding a direct link and causation to osteoarthritis in that surrounding joint. So what that means is that because we have lost elasticity of the ligament, the joint that it's attached to is under more pressure, is under more abnormal use, and because of Wolff's Law, we then start to grow osteoarthritis or increased bone growth, bone spurs in that area. And that can show up in as little as 6 months post-injury. So this is really, really big. This should hopefully be striking you as extremely important, not only for case value, but to show the need for future care when we have these types of things. The patient is not going to be something that's just going to go away and be done when they're done with treatment after a month or 2 months or whatever it might be. They're going to need ongoing care because this is a permanent condition. And the reason they're going to need ongoing care is because these permanent conditions are linked to a degenerative issue as well. There's direct linkage, causation, the research is out there. So I want to make sure that that's really, really clear. I think a lot of docs are missing out on this and not linking this together, but I think this is huge. And also we need to do this to make sure we're doing best by the patients as well.